My name is Dr. Winston Price, a past president of the National Medical Association and Chief Information Officer for the W. Montague Cobb Institute. And I have the honor and pleasure of introducing Dr. Linda Walden, who is a family physician from Cairo, Georgia. More importantly, she is a powerful advocate for health and social justice, a committed leader, fearless spokesperson, and a dedicated community activist. If you are uncertain about getting the COVID-19 vaccine, listen to this encouraging video. Together with you, we can end the pandemic.
Good afternoon, good morning, good evening, whoever is looking right now and listening. Thank you for being on this Zoom call. We're going to be discussing the COVID-19 pandemic and why we all must get our COVID-19 vaccine. You see, the vaccine, the pandemic, COVID-19 pandemic has taken more lives in the United States than any other country. And as of today, over 575,000 people have died, majority being African Americans, and over 32 million people are testing positive with COVID-19. It's sad that we as Blacks are the ones dying from COVID-19 4 to 5 times more than any other race. This has got to stop. And yes, we ask, why is this? Well, number one, we as African Americans have more pre-existing diseases such as hypertension, diabetes, obesity, cardiovascular disease, sickle cell anemia, cancer, you name it. We outnumber other races when it comes to these diseases. And it puts us at a higher risk to get infected. Our immune systems are not as strong. And many of our people don't have access to health care. They don't have health insurance. Why? Because their wages are low. Number one, they work in a lot of, as essential workers in a lot of places that keep our economy going, such as in our stores, stocking our shelves, in agriculture, growing our vegetables and fruits, in factories, producing various things and needs for our society. And their paycheck is less than what their premium would be, So therefore they can't afford the insurance premiums. So this has got to stop. And we have got to speak up and speak out. And as our late Congressman John Lewis often said, we've got to do something, say something, and create good trouble. Because you see, this is part of systemic racism as to why we're disproportionately affected, because we don't have health equity. We're not having the opportunity to be as healthy as we can like other races, and that should not be happening. There is no vaccine for racism. It's going to take all of us to unite and be the change we want to see, as our President Barack Obama has so eloquently stated. So we've got to set the example and let no one be left behind. Because if we're not part of this solution to get rid of this COVID-19 pandemic, we're going to continue to have this problem. And this COVID-19 pandemic is going to take more and more lives. So what do we need to do? Why we need to do what we need to do is get that COVID-19 vaccine. And I can tell you, I know there's been hesitancy. There are people who are saying, no, I'm not getting it because of what happened with Tuskegee experiment. Well, let me tell you something. That was many, many years ago, and things are so much different now. I can tell you, you don't have to worry. I have had my vaccine. My family has had their vaccines, all my relatives, even including my 99-year-old aunt who's in a nursing home at that. She has had her vaccine and none of us had any problems. Most of us had the Pfizer vaccine when it first came out, and we had no problems. And the vaccine, remember, is only a vaccine. It's not going to do anything until it becomes a vaccination, which is why we must get our vaccination for the COVID-19. If we want to see light at the end of the tunnel, if we want to see this virus eradicated, we have got to get our vaccines. There's no ifs, ands, or buts. Or we will continue seeing more African Americans dying of this virus. Now, one of the things that I want to talk about questions I know that a lot of people often have. You know, for instance, why should I get the vaccine? Well, number one, you want to get it because we want to ensure, I want to ensure that not only everyone is safe around us, but to make sure that all of us are safe, including each and every one of you. We want our families, our friends, our neighbors, our churches, our communities to all have their vaccines. So we don't have to worry about anyone getting infected and getting the virus in terms of causing a lot of disease. So we've got to end it, and the only way we're going to do it is getting the vaccine. You don't have to worry because the COVID vaccines do not contain any part of the virus, number one. Number two, they don't contain any food products such as eggs or dairy that people may be allergic to. They don't have any antibiotics in it that many people can be allergic to. So you don't have to worry about that aspect. This vaccine was created, and I must say that there are 3 vaccines. However, 2 are the ones that I'm going to highly recommend, and that's the Pfizer, which is 2 dosages. They're 21 days apart. You take the first dose, and they're available to those who are 16 and older. And then the Moderna vaccine is also 2 dosages, and it's 28 days apart, and it's available to anyone 18 years and older. And I want to also point out with the Moderna vaccine, we are so blessed that the lead scientist to create this vaccine at the National Institutes of Health in the same department with Dr. Fauci was an African-American doctor, an African-American female. Her name was Kizzmekia Corbett, Dr. Kizzmekia Corbett, and her staff were the ones responsible, but she was the lead scientist to develop this vaccine. So I want to throw that out and give her, you know, all the compliments because she deserves it of her hard work in making sure that this vaccine was created. We also have, as I mentioned, the Pfizer vaccine. And also I want to say, you all need to know that the very first person to get the vaccine in the United States, guess what, was an African-American female. And her name was Sandra Lindsay. And she was a critical care nurse that worked in the ICU at Long Island Jewish Medical Center in New York. And so we're so grateful that she took a stand. And she did that because she wanted her people to know that you have no worries. This vaccine is very safe. I can say as well as she can say, it's very safe and it is effective, 95% effective. Now, yes, both of the Pfizer and Moderna. Now, we've heard of the Johnson & Johnson. We've heard that there have been a few people that have had some blood clot issues, about 6 or 7 out of several million. And now they say that it's okay to take. But if you don't want to take it, that's fine. Go ahead and take the Moderna or Pfizer, okay? Because we know they're 95% effective. But make sure you go back and get your second vaccine. Now, why should we trust the vaccine? First of all, this vaccine, as I mentioned before, is not an experiment. It has had its clinical trials done before it became approved. We are lucky in this country that we now, which they didn't back during the Tuskegee experiment, we have the Center for Disease Control, which is very strictly regulated to make sure that whatever is given to our people in the United States is safe and effective when it comes to vaccines. And we also have the Food and Drug Administration, 2 government entities that make sure that the people are safe and they're going to be protected and they're not going to have any serious issues or problems. Now, when you get the vaccine, understand that the reason we have to get the 2 dosages is because, number one, once you get the first vaccine, what that does, how it works, is the vaccine, once it's injected, it's going to activate cells in your body. They're called a part of the immune system, lymphocytes, white blood cells. You got their B and T lymphocytes, and they will help your body to make antibodies, which will fight the virus and destroy it. It will recognize the virus once you're infected. So you're not being injected with the virus, but the vaccine is going to be able to recognize the virus once you do get infected and destroy it from multiplying. Understand that the COVID-19 virus is a part of the family of coronaviruses, for which the common cold is a part of that same family. But the common cold is mild. Unfortunately, COVID-19 can be mild to severe to deadly. Okay. So I'm saying that to you because I want you to understand that this virus will not survive unless it infects someone. Okay. It has to infect its host in order to divide and multiply and cause further damage. It cannot survive just being out in the environment alone. It won't survive very long. So once you get the vaccine, you may still get infected with the virus, but guess what? Your body will recognize it, especially after you get your second dose, which is the boost, like a booster dose. And it's going to tell your body, hey, yeah, I see that COVID's back again, y'all. Let's get him. And they immediately destroy that virus. So you can get infected, but you won't get the disease. You won't get a lot of the fever, the high fevers and the shortness of breath and abdominal pain, nausea, vomiting, losing your smell or taste, losing your hearing. You won't have those problems. You won't be going to the critical care unit or being hospitalized for whatever reason because you've had your vaccine. So know that, yes, you can still get infected, but that doesn't mean you have the disease, because your vaccine is going to destroy it. The vaccine that you have from your antibodies is going to destroy it. The immune system will destroy it. So understand, that's why it's important you get the vaccine. It is safe, as I mentioned. And do children get the COVID vaccine? These are some questions that people have often asked. Well, right now, they're working on a vaccine for children under 12, actually 12 to 17 now. And then after that, hopefully they will come out with one for children under 12, but 12 to 17 is one hopefully will come out maybe this summer or by the fall. So, just stay caught up in the news of what's going on with the vaccine. But we're so happy now to see that this vaccine is available to those 16 and older, and for the Pfizer, and those 18 and older for the Moderna. Now, if you have pre-existing diseases, it's often asked, should you get your vaccine? Of course, you most importantly definitely need to get your vaccine if you have pre-existing diseases. Like I mentioned, the diabetes, hypertension, vascular disease, cancer, obesity, you've got to get it. Sickle cell anemia, you must get the vaccine. Any pre-existing medical problems you have, you need to get the vaccine so that you will stay protected, okay? Now, I mentioned already about why people are dying. So many Blacks are dying because they don't have access to health care. Now, what is the herd immunity? What do they mean by herd immunity? First of all, that is referring to when we can put this behind us because we won't have to worry about getting infected. Once we get 70% of the population in the United States vaccinated, that's why we got to get you vaccinated, because you will help to bring about herd immunity. And right now in this country, we have 331 million people in the United States. And if we want to reach herd immunity, we need at least 291 million people to get their vaccine. That's about 70% of the population. Why? Because when you get your vaccine, as I mentioned before, the virus is not going to be able to survive, because once you get infected with it, your body, from the antibodies made from the vaccine, it will kill it and destroy it immediately. So it won't survive. And then in a few, before you know it, the virus will be eradicated. You won't have to worry about it. But the only way that's going to happen is when each and every one does their part and gets their vaccines. So we've got to really, really, get the word out. We've got to be the change we want to see. We've got to unite and make sure that nobody is left behind. You know, we've got to do our part and make a positive impact on the lives of others by sharing with them, we got our vaccine, now you get yours. Some of them may not have anyone to take them to get it. You can offer to take them, whether it's to the health department, the hospital, a community health center. Many churches are hosting, giving vaccines through the health department, state health departments in their communities. But remember, a vaccine is nothing until it becomes a vaccination. So you've got to do your part. Look out for your brother and sister in your community. You know, if you see that things are not going right and they're not getting access to the vaccines, you got to say something and do something and make sure attention comes to their communities. Because if we don't, more of our people will die from the COVID-19 infection. So please, please take time, find out where the vaccines are being given. They're being given now at many of the drugstores, the pharmacies. In Georgia, we have Cox, Walgreens, we have CVS, we have Publix. So many places are offering the vaccines, and they're all free. So nobody should be charging you for a vaccine. If they do, you better go elsewhere, okay? And also report it, because that should not be happening. So be the change we want to see. Let's make a difference. Let's improve our health as well as those around us in our household, so that not only we stay safe, but all of us are safe. And it's only when we get that vaccine, the COVID-19 vaccine, that this battle will be won. And we can put this pandemic behind us and move forward for a better day. May God bless each and every one of you. For those of you who are listening and have gotten your vaccines, I'm so proud of you. Please let others know how well you did when you got your vaccine. And I want to lastly just say, once you get the vaccine, a few people may experience some fever. It's not a high fever, it's a low-grade fever. They may have some soreness at the injection site. They may have some chills. They may have some fatigue. It doesn't last no more than 3 days, 1 to 3 days, or 72 hours, okay? You can also, have these things happen once you get your second dose as well. But understand, it resolves. It doesn't mean you have the virus, because remember, no part of the COVID-19 virus is in the vaccine, none whatsoever. So you don't have to worry about that. So if I can do it, and all of my family members, including my 99-year-old aunt, who did fine, had no problems, and is doing very well in the nursing home at that, which was highly devastated with people getting positive and dying, and did very well, then there's no excuse. You can do it too. So God bless you, and may God continue to bless America. Thank you.